Your thyroid controls your hormones, which can affect every area of your body, from how fast you burn calories to how fast your heart beats. This small butterfly-shaped gland in your neck can cause a range of seemingly unrelated problems, including drastic changes to your weight, energy, digestion, or mood. Thyroid disease affects approximately 200 million people worldwide. In the United States alone, an estimated 20 million Americans have some form of the disease, and up to 60% of those are unaware of their condition. January is designated Thyroid Awareness Month, a month set aside for healthcare providers to educate the public about thyroid health, diagnosis, and treatment. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain how this teeny gland has such a big effect on our health.
The thyroid is an endocrine gland that controls the metabolism, among other things, and it is sort of the generator of the body's rate of metabolism.
It sits here in the neck just above the windpipe. Thyroid hormone, it can be thought of as the kickstarter for the body. It regulates a lot of key aspects of metabolism. And the parathyroid glands, they sit underneath the thyroid. They're the main regulators of calcium metabolism in the body. If there's too much parathyroid hormone, it causes calcium to be leached from the bones. It can cause a whole array of problems, including kidney stones, depression, abdominal discomfort, pathological fractures.
There's 3 hormones, primarily the TSH, which is sent by the brain telling the thyroid how hard it should work. And then there's an active form of the thyroid hormone, and then there's a storage form of the thyroid hormone. And sometimes the storage form gets built up inside of the place where it's formed and makes a nodule. What I usually see are thyroid nodules, or something you can palpate, something you can touch, something you can see on an x-ray, things like that. They can grow quite large and hide up underneath the collarbone and back towards the spine. They can be asymptomatic other than a little bit of a problem swallowing. If they're cancerous, then we start looking for spread. If we do find spread, then we try to take it out at the same time we find it. Well, usually I tend to want to perform a total thyroidectomy because that can give us a diagnosis for sure, and it's also the initial step in the treatment of thyroid cancer.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Understanding Your Thyroid story link icon on our homepage at yourhometownhealth.com.